All right, everybody. Hi, thanks for coming. I am so excited to finish this series. So this is Canine Geriatrics, what's happening and what can I do to change it? Part 3. And I am going to get started. I wanted to let everybody know that the reason we're doing these lectures is thanks to Sienna, which is Small Animal and Equine Naturopathic Association. They asked me if I would be willing to come in and do some lectures for their people. And I said, well, as long as we're going to be lecturing, why not open it up to as many people as possible that we can help? To let you know about Sienna, they're dedicated to teaching people about natural medicine. So for dogs, cats, and horses, they work globally with the veterinary industry. So most of the people in Sienna are in Australia or New Zealand, but they accept members from other places. And I can tell you, I've done lectures for them and I have watched some of the people. If you guys are interested in learning more about Sienna, you can go to their website at www.saena, Small Animal and Equine Naturopathic Association.com.au, or contact them at info@sienna.com.au. All right, so let's get going. I wanted to say thank you to all of our sponsors. So in full transparency, I own Optimum Pet Vitality. My mission is empowering people to help optimize pets' quality of life. And in doing this, we have some courses. We have Tuning Into Your Dog, which has been amazing, which is for both pet parents and professionals. The other ones I have listed here: Optimum Laser Therapy, Fascia 101, Cranial Cruciate Disease, and Confident Canine Care, Masterclass and Exercise Therapy for Every Practice, are all professionals, and they have a pet parent counterpart. I want to say thank you to my sponsors. Every company here I have used and highly recommend. I went to them and said, hey, do you want to work together? And they were like, absolutely. So in the food world, we have Medicus, Simple Food Project, and Evermore. In the laser world, we have Respond, SpectraVet, and Avant. All have professional lasers, and Respond and SpectraVet have pet parent lasers. We have multiple supplement companies: Standard Process, Myos, and Jope, and BioPup. All make amazing. My dogs have been on all of these. I've been on Standard Process and Myos. And Assisi, which I literally did the original clinical research for 20 years ago, 4 or 5 owners ago, and highly, highly recommend. I have multiple in my possession at any time. So recap for lesson 1 or video 1, lecture 1. We talked about geriatrics. What is it? What is it entail? In dogs, depending upon the size of the dog, it can be anywhere from 7.5 to 11 years old. We talked about how the Family Physicians of Canada have a statement, which I don't know if you know this, but for any medical group to have a statement, it means that basically everyone stands behind it. And to me, this is super huge. If there's no trauma, so no acute injury, moderate exercise does not lead to the acceleration of stifle OA. So in humans, this is obviously physicians, so human doctors, the number one place that people have OA is their knees. So this is saying whether you have arthritis or not, pre-existing condition, exercise is not going to make the knees worse. In fact, it improved physical function, decreased pain and disability, and they considered it a highly underutilized pain management tool for osteoarthritis. So super, super, super important. We talked about what sarcopenia is and how as dogs age, their muscles turn from muscle to fat to fibrous tissue or scar tissue. We talked about the spiral of how they age and go down and how we can help them go back up to have optimum quality of life. We talked about concentric and eccentric exercises and how with our more frail patients, we start with isometrics. and you say, oh, isometrics. Yeah, let's do a plank. So if you're like, oh, isometrics is too easy, do a plank for 3 to 5 minutes and then tell me. We talked about inactivity decreases health. It's one of the things that can cause, so inactivity can cause the most damage to our health, and exercise and increasing VO2 max is huge for in humans, decreasing what they call the four deadly horsemen. So the most common causes that you're going to die from, and exercise is huge for that. How just aging decreases the number of blood vessels, the number of growth factors, and the ability for our tissue to respond to those growth factors, and then also cognitive changes. So if you're like, oh my God, I want to know more about this, click into the replay of our first discussion and you'll learn about that. Real quick, in our second discussion, we talked about canine cognitive dysfunction because that is becoming more and more a much bigger thing, and how to treat it with laser, PEMF, and targeted exercise. We talked about the obesity and how to really tell where your dog is in that chart. We talked about metabolic changes that happen with aging, with the immune system, with healing, the cardiopulmonary system, so heart and lungs. We talked about gulp, so laryngeal paralysis for our geriatric patients, neoplasia, and then how to deal and cope and help your patients with challenges from getting older: incontinence, ulcers, blindness, deafness. Okay, now we get on to discussion 3. Yay! Exercise. Exercise is so important, both to slow down the aging process as well as to help our aging patients or pets feel and move better. When I look at a dog and put together an exercise program for them, one of the things I am constantly thinking about is after the exercises, they should either be the same or feel better, move better, and do normal daily functions. And you're like, okay, Laurie, what's normal daily functions? That may be going up the stairs. It may be getting on the couch, getting on the bed, jumping into the car. The things that they normally do or should be able to do, we want them to do the same right after exercise or even better. Things that we look for. If they are more lame, meaning they started out lame, but now they're worse, or they are lame. If they're sore after resting. So if they do the exercise and they feel great, and then they go lay down and they get up and they're like, oh, no, I can't move. We need to change something. If they have negative changes in transitions, so we go from stand to sit to down to sit to stand. If all of a sudden they're shifting their weight or they're pulling forward, then we know we have to change something. If they have a negative change in posture, so literally just, okay, I did the exercise, now my left rear leg hurts, so I'm going to lean over, then we need to change the plan. So before putting together an exercise plan, the things that I look at are, how are they standing? Are they shifting their weight forward? Are they shifting their weight back to the left or to the right? How are they moving? And I would love to say, watch them walk and realize that border collies and most Aussies don't really walk. Walking is an uncomfortable gait for them. They may trot slowly, but if you ask them to walk, you're going to be like, what's wrong with that dog? And nothing is wrong with them. It's just the way they're built. So they're much more comfortable in a trot. We look at transitions. We just talked about that. And we look for, are they doing it slower? Is it harder? Or is it asymmetrical? Immediately after each exercise, we look at that stuff again. And we need to think, okay, well, Laurie said if they're doing blank, then we need to change something. What do we need to change? So let's talk about the things that we can think about. All right. So this may be the wrong exercise. So I'm going to give you examples so you can think about it in your head. If I said, I want you to work your abs, there's a difference between doing a sit-up and being in one of those things that you put your arms on and then you bring your legs up. Much harder exercise. So if they're sore afterwards, it may be the wrong exercise. You can still work the same muscles, but you may have to do it slightly differently. It may be too many reps or too much volume, right? Again, let's stick with sit-ups. I can say, all right, I want you to do 3 sit-ups. And you're like, ah, that's nothing, right? But if you've never done a sit-up, that may be a challenge. And I can say, okay, I want you to do 300 sit-ups, right? Same exercise, too much volume, unless you have amazing abs. And it may be too close together. So I can say, okay, I want you to do 25 sit-ups, but I want you to do it every hour, right? And that may just be too frequent. And at the end of this, we're going to talk about how to create the exercise plan using all these rules, but we want to go through the exercises themselves. So if we're having any problems, we want to think about we need to change at least one of these variables. Okay, we're going to start with the easiest, softest exercises and how to get into them and then work up. So you may have a dog who is just frail, right? They may be, oh, I'm 16 and a half. Like, I don't remember, I'm sorry, who said it, that their dog is 16 and a half. That is amazing. And they may have a much better day if we do things like before they get out of bed, give them a rub down, right? Why would we do that? It's increasing warmth because in their body, as we said in one of the past discussions, they have less blood vessels, which means, and their heart literally is weakening, so it doesn't pump as much. So warming them up and getting blood flowing through their body is amazing. There you are. So just coming in, and you may not be able to see. Oh, let's see, there's Sid. Just getting up in the morning and rubbing them. And Sid's only 8, and I do this to him every morning before we get up to get his muscles all warmed up. And let me tell you, he loves it. And the belly rubs. So we can do that. I have clients that I will have them get up, throw their towel in their towel warmer or their blanket in their dryer, go take a shower, get ready for the day, and put that on their dog. And then by the time they get breakfast ready for the dog is like, I am warm. This was amazing. You can do that with your dog. You may come in and either have them stretch, and we're going to go through some stretches, or gently move their legs around and stretch for them. Other things we can do is getting the day right with helping them. If any of you guys do yoga or Tai Chi, or you're just used to stretching, stretching wakes up the body. It stretches the fascia, it stretches the muscles, and we can do that with our dogs. And that's going to give them a better day every day. So things that I recommend starting with, cookie stretches and rhythmic stabilization. And we're going to go through both of those in just a minute. So let's start with rhythmic stabilization. That is where you stand, you have your dog stand, and you gently push them. You're going to ask them to stay. So I usually put a hand on their collar, and I'll show you a video in a second. And then you push them until you feel them contract. So not enough to have them fall over or step out, but just enough that they push into you. And if you've ever been like, oh, get out of the way, right? So your dog may be used to, if I push you, step. So you want to communicate to them, stay. So as soon as they start to push into you, you want to praise them. Praise is super huge in this. All right. So here's Ollie. He's 12 in all of these videos. So 12-year-old Mastiff. We had him until he was 14. He's amazing. But you can see me pushing at the hips, to the left, to the right, the chest, the shoulders. I'm pushing him, or pulling, in that case, back. There you go. I can do diagonals. By doing it in different places and in different directions, I'm literally turning on his core muscles. And I just pushed a little bit too hard because he stepped out. And if you watch him, he's 12. Look at his muscles. You can literally see him contracting his muscles. So if you have multiple people, you can have one person stand up and just push the second person. Now, you may not have 2 people. I don't have 2 people. I just have me and Sid. But it's super fun. And what you'd find is as you push the person, at first they're like, And then they're like, okay, I contracted that muscle. And then you push it a different direction, like, okay, now I contracted this muscle, and then this one, and then this one. And then you push, and all of their trunk is turned on. And it's the same thing for our animals. It's amazing. There's cookie dance. This is where I am moving the cookie and their feet stay square. So you can see I have a hand on Ollie's collar, and I'm moving the cookie around. I'm asking him to stay. So I'm not taking the cookie anywhere where I would be asking him to get the cookie that he would have to step out, right? Because that wouldn't be fair. I'm giving him the cookie. So he's like, oh, this is definitely worth doing it. And my cookie has a high enough value that he's willing to work on his neck, his center of gravity, his balance. Wonderful exercise. If the dog is super weak and they can't go for a long walk, you may be able to help them. I'm sure you've seen dogs in strollers or wagons. You can take them to the park because remember, the house is just a big cage, right? Once you've checked everything out, it's kind of stays the same. So going out, either outside, sometimes the yard is an even bigger cage, but going to the park or to the pet store or Lowe's or Home Depot, somewhere else, that's cool. That stimulates the brain and gets them willing to do more. So you may take them in a wagon or a stroller to the park and then let them walk around there. Or if they're really, really tired, maybe bring them some leaves or twigs or something to smell to get them excited about life. Toss them a ball so they're in a new place and they don't have to move too much. Help strengthen the trunk. Even just riding in the wagon or the stroller, if they're standing up, helps with their balance. So brain and body. All right, cookie stretches. Yeah. Let's see, we're going to start with this one. Oh, there we go. Now I'm asking him to move his feet. Now my goal is not just to move his neck, but to move his whole spine because I don't want him to have back problems. This is like us doing, again, like yoga, right? So downward dog, upward dog, bending over, leaning back, sideways. I'm going to do that in a second. So I have him come with his nose to his shoulder, behind his front foot, then right next to his body, to his hip, and then down behind his back foot, to his chest, to the floor, and then even into head. He's 12, and he was doing headstand position. So he is literally flexing his whole back, right? Our border collies, my border collie patients literally can take their nose between their back feet. They're crazy. Super, super cool. And then if we come to this one, so he has done lateral flexion, he has done straight flexion, he's done rotation, and now he's doing extension. So front feet up and elevated, nose to the sky. There we go. All right. His body in all different positions. All right, you guys ready? I can't see you, but I'm asking you to do this. Everybody stand up. If I tell you something, you may or may not learn it. If you do it, you will remember it and you'll remember it better for your dog and your patients. So stand up. We're going to do a side bend. We're going to hold it. 1, 2, 3, 4, 5, right? We can do the other way. So do it with me. 1, 2, 3, 4, 5. You're going to bend down and touch your toes or go as far as you can, or if you can, put your palms on the floor. And then we're going to come up. We're going to extend. So take your hands behind your back and go back as far as you can. Don't lose your balance. And then I want you to take your right hand and go behind your left heel. Triangle in yoga. Here you go, Sim. And then come up and go the other way. And you should be like, wow, that feels really good. Yeah. It feels really good for you to do it, and it'll feel really, really good for your dog to do it. All right, that's cookie stretches. Now, again, you may have a dog with low endurance. So when we say take your dog for a walk, it may literally be, come on, you can go back up. There you go, bud. It may be out to the mailbox and back. You may have a rest. It may be go outside, just walk around the outside of the house. Or if they're super frail, it may be just walk around the inside of the house. Something to get them up and moving frequently. And it can be okay. You know what? They can't do very much, but we can do it every hour or every couple hours. Or if you're working all day, before you go to work, as soon as you get home, and before bed. That will help them build so that when you're not, hi, sweetheart, when you're not at home with them, they're more likely to get up and move. You can have them on movable or unstable surfaces. So it may be like a rocker board, and we'll go through rocker and wobble board separately, but it could be on a pillow. You can have it be just the front legs. It could be just the back legs. You can have all four legs on there. You can even walk around on it. How many of you guys have ever been on a trampoline? Right? Have you been on a trampoline and you're standing still and someone's walking around you and it's really affecting your balance? You do the same thing with our dogs. You can walk across the bed. You can just put some comforters down. Just make sure. I know you want your rest of your dinner. You can put some blankets down on the floor for them to walk over. And it's a challenge. Make sure they're not going to fall. Make sure you don't have grandma living with you where she's going to fall over something. So make sure everything is safe for everybody in the house. But it works on their balance and proprioception. And then you can even do, like in here, a air mattress. And again, if you're walking on it, that is going to be a huge challenge for their balance. You can do sit to stands. This is me and Chloe, and I'm literally stimulating her similar to like the rhythmic stabilization by touching her butt. I'm getting her to stand up, and then I'm asking her to sit. And it could be once in a while, and it can be 5 to 20 in a row. All right, you guys ready? Oh, Christine, can you help Kaya House shut off her video? And so what you,
that all seems kind of strange, right? Well, what's interesting, I think, most of us, right?
you've got somebody with their that's not muted. Thank you. All right, so we're gonna do some chair squats. Ready? So everybody come up and come down. And come up and come down. One more time. Come up and come down. All right, you can feel your quads. It's the same thing. You doing from a chair to a stand is like a dog doing a sit to a stand. You can do leg lifts. So how many of you guys have done leg lifts in like aerobics or an exercise class, right? We can do this with the dogs. You may see this bird dogs where you're on all four picking up a leg. It helps with the trunk. It's the same with the dogs. So again, here with Ollie, I'm picking up one leg, very gently holding it. You may see him sway. That's exactly what we want. If he's swaying, it means he's stabilizing. He's using his trunk. We don't want to take it to the point of collapse. We don't want to drop their feet. That's rude. You want to lift it, hold it, and then gently put it back down for them and pick up the next leg. One repetition, as long as they don't have something that's painful, would be to do all four legs for the same amount of time. You can see here's his surgery leg, so picking up the other side was much harder for him. Making sure he's nice and square. And he's like, oh, you can see his face. He's like, I got to work really hard. Once they're used to doing one leg lifts, you can do 2 leg lifts. If they're having trouble with this, you can use blocks. So rather than just picking up your hands, this is Bungee, and Bungee is stabilizing on the down legs, but has a little bit of weight on the up legs. And if you're like, oh, that is way too easy for my dog, I can lift their legs up. Don't start with this. But this is an advanced where you're literally coming up and out, right? Same with those bird dogs. The higher up and out you go, the more challenging it is. Super important. Don't adduct or abduct the limbs because that actually is either going to help them or hurt them. So it may be helping with their balance, but if you go too far, you're going to knock them over, and they just can't compensate for how far you're taking their legs out. There's cavalettes. So again, if you have a fragile dog, having the cavalettes be 1.5 body lengths so that they can get 1, 2, 3, 4 feet over one bar before they get to the next one. As compared to if they're stronger than that, you can have them be stride length apart. Again, here's Ollie, more of a challenge where it is higher bars and closer together. And you can see Lulu here. She was 14 when we took this video, and she's like, I can do this and I can cheat a little bit too. So fun. You can see from the dogs, they love, love, love this. Helps them tremendously. You can do weave pulls. Now this is Zipper. Zipper is not just a geriatric dog. She had back surgery, so you'll see she's shaved. But one of the cool things about this video is you can see how she struggled so hard in the beginning. And then we get to the end of the weave pulls and turn around and she's like, oh, I've got this. Literally, her body learns how to do it. So it helps her balance, proprioception, how to move her legs, how to shift her weight from left to right. It's wonderful. Progress to figure eights. So pivoting is much harder than just weaving. And again, you'll see she struggles a little bit at the first. And just by doing it one more time, she's like, oh, I have better control of my legs. And that keeps going throughout the day. It's called carryover. It's a wonderful thing. Here's sidestepping. One of the most important exercises you can do for dogs. It helps stabilize the hips, the shoulders. It works on the knees. Now, I laugh because I did this. I don't normally pull, but you would have only seen my butt if I had come around on the other side. And then this is Rudy. He's my dog. At 12, we took a leg off, partial amputation due to osteosarcoma. And we were told that if we didn't do chemo, he would have 3 to 4 months to live. And I can tell you with Chinese herbs and diet, keeping him on a cool food, I had him for 43 months. So as a rehab mom, it was an amazing success because here he is with his prosthetic that he could run and play in the snow. I had him till he was 15. It was amazing. But you can see here, he literally, as he got older, laid like this and stretched his pectoral muscles and then had trouble getting up. So I learned, obviously, if I am strengthening the muscles rather than just having them in stretch, he had a better quality of life. There's rocker boards. So this is moving left to right, and this is my amazing Sid. And this shows how you can do it with all 4 feet. You can do it with 2 feet. This is just going left to right. You can do it front feet. You can do it with back feet. I like to control the board, and I'll show you other pictures of other ways to control it. But this gives me tons of control. And if you have a dog that's smaller, this is a wooden spoon with some frozen peanut butter on it. So he is thrilled to be able to work, and I don't have to lean over and hurt my back. So your biomechanics, super important. This is a great exercise for all age dogs. So here's different ways to control the board, right? It can be me on it. It can be 1 foot on it. It can be sitting down and working it, or it can just be the dog. There's backwards. So again, here's Rudy when he had 4 legs. Going backwards, what I want you to see is that the cookie has to be at the right height, and you want them to take big steps back. You don't want to have the cookie high, or they're going to sit rather than take big steps back. So here's perfect height. This is with Bingo. You can have a hand on their harness or collar, and a hand on their thigh, and gently walk them back. You can even be the rooster where you are a little bit intimidating. You look down on them with your hands up. You may even need to put the bottom of your shoe on the top of their foot. And they're like, what the heck? They step back. You bring your arms down and you say, good job. Here's a cookie. And they're like, oh, that's what you wanted. So praise is super important in all things. There's a wobble board. So here we are, and this is Corey, and you'll see both Corey and Ollie in just a minute in videos. Great for having them, again, geriatric dogs, puppies, everybody. Strengthen the front, the rear. Let's go into watching. So Corey, she was older here, maybe 5 or 6, but not a puppy. But you can see how just getting her on it, she's shaking. So good for the muscles to get them to help stabilize her body. And then we have Ollie. Again, I love that dog. Oh, I can do his front legs. I can move it in all directions. So I'm changing. Now, obviously, you want to make sure that his back toes are not going to be under the board. But then I can bring him all the way up. There we go, all 4 feet. And I can work his whole body. All right. Creating the exercise plan. If they're super weak, sometimes just going out to the mailbox a couple times a day is all they can do to get started. But then we always want to challenge them. We want to make sure that our goal is to have them be successful, and we want to have it be a positive experience where they have fun and continue to get strong. If muscles are not pushed to the point of fatigue, then we can do an exercise every day. It's like if I ask you to go up the flight of stairs, right? Now, if I ask you to go 50 flights of stairs, that would be a lot. But if I said, okay, we're in a house and there's stairs behind me and you have to go up 1 to 3 times a day, that's okay. And then you can build up. The harder the exercise, the more likely that they are to get injured if you do it too often, because they can't compensate, they can't regroup and rebuild. So if you have a exercise where they are fatiguing, right? So you have signs of fatigue, then you might want to do it 2 to 5 times a week. So if they're like, oh my God, that was hard. I did it, but it was hard. Twice a week is a lot, right? You may even, if it's super hard, go to once a week. But if they're just barely fatiguing, like I'm tired, but you know what? I'm going to sleep for half an hour and now I'm up and I'm ready to roll. You can do something like that 5 times a week. And it's going to depend upon the dog. All right. I'll answer questions in a minute. But this is Sid. Dreaming the impossible makes it possible. So Sid is one of very few dogs in the world that can walk on a round ball. You can see here, he can do it forwards, backwards. He can go side to side. He can do spin and twirl, all with 0 assistance from me. The reason I have this on here is so that you know what possible is. Sid came to me and he was 11 months old, and I said, dude, I love you, but you have straight knees, straight shoulders, and a long back. I am a rehab vet. I am not going to let you have a shoulder injury, a cruciate injury, an iliopsoas, or a back injury. And I put together an exercise program for him. And that's where Core and More and Confident Canine Care came from. I shared that with friends and they're like, oh my God, Laurie, this is amazing. One of my dear friends, Laura Fern, actually worked with her dog, Sophia, and we started at 9. And at 11, she was an agility dog. At 11, she was the 7th fastest Sheltie in bad dog agility, with everyone else in the top 10 being 4, 5, or 6 years of age, right? Doing exercises literally increases longevity and quality of life. All right. If you're interested, we have a free ebook. You can scan the code and we will email it to you. So it's the top 5 exercises. I think it's like a 25, 26 page ebook that I put together for people so that they have something that they can give to their clients, that they can share and have at least some exercises where they have a good explanation of what you can do with your dog. It's a great starting place. So I'll leave that up for another second and I'm going to pull my chat over and see what questions. So I'm going to start at the top and look through the chat. And if you guys have questions, please put them in. I would be so honored and happy to help and answer them for you. Let's
So,
see.
Dr. Laurie, our first question is from Tracy, and it is, does geriatric include dogs over 11, or is that categorized differently? And Tracy, if you could let us know what breed you have, that would be helpful.
I'm guessing Tracy, since I know Tracy, it's border. So yeah, so large dogs start at, so giant breeds are 7.5, all the way down to tiny dogs are 11. So by 11, you're definitely geriatric. Um, and let's see, Robin says, what exercise modifications do dogs with degenerative myelopathy require? Oh, great question, Robin. I have a whole lecture on DM. The number one exercise, the number one muscle, the first muscle to atrophy in dogs with DM is the biceps femoris. It's the outer back muscle in the leg, and it's super important because it does extension of the hip, the stifle, and the hock. So it's a major standing muscle. And the best exercise, oh, it also does abduction. So it's one of the pee on a tree muscles. So the best exercises for dogs with DM, backwards and sideways. Same for hip and shoulder stability, backwards and sideways. And you may have to even put them in like a walkabout or help them up to have them do that to be helpful. And if your dog has DM, even doing rhythmic stabilization starting standing, but as they get weaker in the back end and then the front end, you can do it in tall sit, you can do it in sternal, so sitting up on their chest. As long as they have the ability to push against you, it can help. And if you take a dog all the way to the end, when DM takes your dog, it's because they get aspiration pneumonia. If you go as far as you can with them. So working with them with breathing so that they can use their chest muscles, the muscles, the intercostals between the ribs. So Christine, wake up fairy. We're on lesson 1 and our 14-year-old on December 22nd has improved leaps and bounds, bursting with gratitude for Dr. Laurie. Yeah.
Hooray! Hooray! So our next question is
Yeah.
cognitive dysfunction expected in all dogs, and does it just come along with age?
So if you know someone who's in their 90s and as sharp as a tack, and you know someone in their maybe early 80s who you're like, oh, yeah, you asked me that question 4 times already, there's a difference. So does it happen with age? Yes. Are there a lot of things we can do to slow it down? Absolutely. I turn 60 next year. I'm studying geriatrics. I do everything I can to combat that. And there are lots of studies in humans and animals, including dogs, that show that we can not only slow it down, but reverse it some. Right. And in our last lecture, we talked about using laser on the brain and decreasing inflammation and some of the different supplements. I know I'm on phosphatidylserine every night before I go to bed. There's lots of things we can do to help keep them strong mentally as well as physically.
All right. So our next question is from Disney Drenched. For dogs with arthritis and kidney disease who can't take NSAIDs, what can they take besides Librela, if anything?
Great question. So, Librela is kind of a hot topic. I'm going to give you my take on it first. It is like a chemotherapeutic drug. If you have cancer and nothing else is going to touch it, it's great. If you're living your life and you're like, yeah, I have a pain in my hip, you're not going to take a chemotherapeutic drug. So, Librela, when there's nothing else left, can be helpful for dogs. Is not a start with because it can have side effects. Can't take NSAIDs. There's a ton of stuff. So there is Duralactin, which is over the counter, and I am not prescribing it. I'm just telling you about a product. But it is a milk-based product that can decrease inflammation in the joints. Oh, the number one thing is omega-3 fatty acids, right? That is, there's no more supplement that has amazing research about it than omega-3 fatty acids. And I do recommend going through different ones. So like I like Nordic Naturals. I love Standard Process VF Omega. There's multiple, Dr. Tobias has one. Highly recommend omega-3s. There's glucosamine and chondroitin supplements. There is, well, Jope and BioPup both have UC2 collagen. So what you want to know there is if you're using a product that has collagen in it, you do not use a glucosamine and chondroitin product at the same time. If you want to give if you want to give multiple products, you can do that where you can give one in the morning and one at night. But both BioPup and Jope are excellent, excellent products. Massage, acupuncture. There's so much you can do for these guys. Using the Assisi loop, you can use it depending upon the size of the dog over the kidneys. There are studies that show the Assisi loop, and I have arthritis in my knees. I use it on my knees all the time. And yes, it is FDA approved for humans. It can take 3 to 4 weeks of using it 3 to 4 times a day to have significant effect. But there's research that shows with the Assisi loop that they did a study, NSAIDs, it was Previcox, I think, versus the Assisi loop. And all the dogs on both systems got better while they were on it for 3 weeks, right? It was 3 times a day with the Assisi loop or once a day with the Previcox. But the big thing was when they took them away, the dogs that were on the Previcox, the NSAIDs, they got sore again. The dogs that had been treated with the Assisi loop, even though it was taken away, were still better 4 and 12 months later. So you're not just decreasing inflammation, you're helping heal the joint.
So we're on to Pamela.
Okay.
Who has a 15-and-a-half-year-old Aussie. He's doing pretty well, minus walking trots. Great. And she would love to keep him mobile. He wears a Spectra therapy coat 24/7.
Yep. Yeah. So that's an LED. It has multiple LEDs in the coat. LEDs can be beneficial to increase ATP production in the mitochondria. Lasers can work as well or better. Not everybody can afford a good laser. It's not worth getting a bad laser. But if you have multiple dogs, SpectraVet and Respond both have pet parent lasers that you will use for decades. So many dogs can be treated with it if you've got multiples or, for years. And again, we have the course at-home pet therapy. We have which is at-home laser therapy, which covers all the joints on how to use the lasers. And if you are in the course, you get 10% off on either a SpectraVet or a Respond pet parent laser, which more than pays for the course. And we have the professional course, the Optimum Laser Therapy, that is 20 hours race approved CE, that if you are in that course, you also get a 10% discount with SpectraVet and Respond on any of their lasers, which again more than pays for the course. So laser therapy is amazing. Again, I use it on myself all the time.
So now we have Misha with Bruce Wayne, and we love Bruce Wayne and the crew. And Misha, thank you for joining us tonight. So Bruce Wayne is a long-haired Chihuahua, and he has an enlarged heart with a heart murmur. And she wants to know, how would this affect how much he should exercise? He does walk about a mile a day, or 3 to 5 times a week in winter.
Yeah, so again, I can't say specifically because I haven't put my hands on Bruce Wayne. Um, Doing targeted exercise is something that I would highly recommend adding to his walks. So in humans, they show that the most important thing you can do for longevity, because again, I study it, is three different types of exercise. So your endurance exercise, which is your mile walks, your strengthening exercise, which is your targeted exercise, and then balance and proprioception. And again, in both the professional confident canine care and in the pet parent core and more, we have the strengthening exercises and proprioception exercises. You want to not ever let him get to the point right when he's doing his exercise. You can watch his gums to make sure they don't turn blue. He should never get anywhere close to that. And he should be able to have fun, talk to your vet, right? Because they're the ones who have listened to his heart and have an idea of what's going on. Don't stop his heart medications without talking to your vet, or even decrease them if he's on anything. That can be a bad thing because you don't know it's bad until it's too late. But strengthening exercises would not put a lot of pressure on his heart and would help him tremendously.
So next we have Christine Wake Up Fairy, which I love the name. She wants to know about PEA, and they stopped Librela and Rimadyl after almost 2 years, and PEA has been a game changer. What do you know about PEA, Dr. Laurie?
Um, I know that there is research on it and it can help some dogs. And if it is helping your dog, Christine, that is wonderful. I am so glad you were able to stop the Librela and Remedil. That is huge. I would always rather put them on something that is going to help them rather than something that may help them but has a lot of side effects. So, yay for Christine. You're on the right track. Oh, and I'm seeing Tracy. Tracy, you're yes, Lyric. Oh my God, I love Lyric. I just saw Lyric. What was it last year at UKI? Almost 15, feeling a little more confident about her since hearing the talk. Yay! She's doing pretty well. Got her age, but I think her decline in the past 6 months has come with a slight decline in cognitive decline. Yes. Today she had a good swim for 10 minutes. Yay. I hope to keep her happy. Just not sure if I can see any progress because of this. Is it reasonable to see improvements at her age? I feel confident I can keep her from aging faster. Yes, 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 yes. There's studies in humans that until, well, okay. So there's studies in like 90-year-old people who start exercises. You've probably heard of silver sneakers. That are they ever going to get to be where they could be when they were 20? Absolutely not. But do they improve? 100%. Yes. Until the very end of your life, both your brain, you can create new neurons, as well as your body. You can work and not only slow down sarcopenia, but literally build muscle back up. So I know this may be a little bit crazy, but when we age, we lose our type 1 muscle fibers. When we lay around, we lose our type 2 muscle fibers. So we literally want to work with the fibers that we can so that we can compensate for the fibers that we lose just by, and I think I actually switched that around, but we can compensate for the fibers that we lose for aging by doing our exercises. So super important. Yay, Lyric. Keep going. Supplements are wonderful for cognitive dysfunction, and literally just doing brain games helps tremendously. Oh, and I see Margie. Omega-3s are distilled to remove heavy metals. Yeah, Nordic Naturals is amazing. Um, just don't get the big brown bottle from Wally Shop. Yeah. Just so you know, with all supplements, there are good ones and there are not so good ones. And sometimes you have to do the more expensive ones to get the good ones. But yeah, you don't want anything with heavy metals. And unfortunately, more and more of our fish are coming in with heavy metals. So you need to have it tested. Thanks, Margie. More is amazing. Thank you, Christine. What else you got for me, Christine? Oh,
Sorry.
okay.
Oh, sorry. We have Abby, and she has Miss Lady. Oh my goodness, she is 16 years old. Yay, Abby. She does have a heart murmur.
Mhm.
Oh, I love she is food motivated, aren't we all? um, so she does seem to get a little sore a day after exercise, but keeps going. Is it appropriate to continue short daily sessions throughout the week? And she is on, oh, I am going to massacre this. Nicotinamide
Nicotinamide mononucleotide and
and nicotinamide riboside.
riboside. Yep.
Okay.
With
With UC2. Yes, there
yes,
we go.
yes, yes. Yes. So yes, your nicotinamide mononucleotide and nicotinamide riboside can help increase ATP production. So those are great supplements. UC2 is awesome. It is a collagen supplement that actually attaches to the pyre patches in the gut so that it decreases inflammation through working through the gut. I would say for Miss Lady, if she is sore the next day, I would do a little bit less, but do it a little bit more often. And see if just by breaking it up, kind of like if I said, if you've never run and I say, I would need you to run a mile, you'd be like, I'm going to die. But if I said, okay, I need you to run a house, walk a house, run a house, walk a house, you'd be able to get through that mile pretty easy. And it's the same thing by separating things out. If you're doing like 10 minutes of exercise with Miss Lady, do 5 in the morning and 5 at night and see if that helps her. And then from there, you can build. But we definitely want to not have her get sore because if she's sore, she's going to do less when she's sore. And that can actually be a detractant rather than necessarily a something to help us move forward.
Thank you. Our next question is from Andy, and she is curious to know your opinion on PRP for arthritis and muscle loss and weakness in a hind leg.
I will be 100% honest, not my area of expertise. So I have not used PRP because I do house calls right now. And I know there's research out there. I have not heard of using it for muscles. I've heard of using it for arthritis. But again, I don't want to give you information that I don't have the most recent. And I know there's been a lot of new research and I just haven't followed it. So I apologize for that.
So we are on to Andy, and she wants to know your. Oh, so I'm so like, nope. So Lawanda, thank you. Are walking backward and sidestepping okay for a dog with previous bilateral TPLO?
So not the first 12 weeks, but if your dog has had it more than 12 weeks and they're not lame, absolutely, it's amazing. Because if you think about it, sidestepping actually puts just a little bit of side bend into the knee, so that can build the fascia and the tendons and ligaments around the knee. But you want to wait until it's totally done healing to do that. Same thing with backwards. When you have a TPLO, you're not getting rid of that shear force. So you want to wait until it's scarred enough so that it's stable. So TPL, that's a whole nother lecture. Let's just say at least 12 to 16 weeks after the second, at least 12 weeks after the TPLO, unless you're like, it's a 16-year-old dog, then I'd say 16 weeks. And you're going to watch them, right? If you go backwards or sideways and then they're a little bit sore, it may be a little bit too early. But if you're like, oh, it was last year and 2 years ago, absolutely, it would be great for them.
Thank you. So then we've got Cynthia with, what is your experience with Myos or other products to help slow sarcopenia?
Sarcopenia. Yep.
Thank
All
you.
right. So, yeah. So I will tell you, I am on the advisory board for Myos. I'm lecturing for them at VMX in January. Actually, that's what I was working on today is my lecture. And I will tell you the story of why. I saw their research, and I'm a research nerd. It's like what I brush my teeth to in the morning is reading and listening to research. And I heard their research on geriatric people, and this was when Ali was 12. So this is at least 3 or 4 years ago. And I read the research. I read the research on their athletes, and I called them up and I said, "Hey, listen, I lecture nationally and internationally. If what you have here is real, people need to know about this." And I said, "You send me enough free product that I can use for my dog. You can send me as much or as little as you want. And if I see a change in my dog, I do exercises with him every single day. I know exactly what he can do. Then I'll let people know about it. And if it doesn't, I won't say anything bad, but I just won't talk about it." And they sent me a 12-week supply. And Ali went from being able to do sit up and bag with me holding one paw because he couldn't do it by himself to being able to sit up and bag. And we got up to 12 high fives, which is turning, so changing his center of gravity. And I was hooked. And I can also tell you that when I broke my fibula a couple years ago and I watched, again, I'm a little bit older, the atrophy in my leg because I had to be non-weight bearing for 8 weeks, my brain went to, what can I do? What can I do? And I'm like, wait, there's Yoked. Yoked is the human version of Myos. And I called them up and said, can I order some Yoked? Because I'd been ordering Myos for my dog. And they said, "Psst, Laurie, it's the exact same thing, except that the human product has vanilla flavoring in it." So I looked it up and I'm like, oh, the Myos is cheaper. So I can tell you, as I'm getting older, that every day that I have a shake in the morning, not only do I have my collagen and my whey protein and all of the other stuff, there's 2 scoops of Myos in it. And that is the truth. And I am on it because I believe in not only the research, but what I've seen do for dogs and humans. All right, that's my Myos story. What you got next? Christine? All right, hold on. Let me start scrolling. Michelle Frank, what exercises are best for double luxating patella? Oh, grade 3 to 4. Oh, thank you, Michelle. Can you exercise? Are you going to? Yes, you can exercise. You can work on the quads. You can work on the cranial tibial muscles, on the hamstrings. Cavaletti pulls would be the best thing. And it's not going to get your knees back in. At that point, the question is the dog okay? At grade 4, I've seen it in grade 4 where the patella literally attaches to the outside of the joint, and nothing's going to fix that. Even surgery is really difficult. So you do the best you can with what you have, and you keep them comfortable. But if they can do Cavalettis, that will at least strengthen the muscles around the joint to help stabilize the knee and decrease the chance of luxating of tearing the cruciate. Because once the patella is out, that destabilizes the knee, so they're more likely, they have more shear force, and they're more likely to tear their cruciate. Let's see, Abby, Miss Lady, glucosamine chondroitin. I don't use with collagen or type 2. Is the main reason for controversy the use of glucosamine and chondroitin? I thought remembering learning several years ago, glucosamine and chondroitin may not be effective. It seems to cause stomach issues, so I stopped. Absolutely, anything that causes stomach issues, you want to stop. Curious to include again to revisit with a different brand with a probiotic and avoid using with collagen. So understand there's two main types of collagen. There is UC2, which is chicken sternum that is undenatured, right? That is a patented product, UC2. There is also hydrolyzed collagen. So UC2 works in the GI tract at the pyre patches. Hydrolyzed collagen goes into the system. I personally am on Great Lakes Collagen. I have no affiliation with the company except I've been on it for probably 15 to 20 years, and it makes a huge difference in my hands if I'm on it or not on it. So it is the body uses the amino acids that are in it to help rebuild the cartilage. So it's a different product. The reason with UC2 and collagen is there was a study that was done that looked at UC2 by itself, glucosamine and chondroitin by itself, and together. And when it was together, dogs actually did worse. So it's better to do one or the other. My rule for glucosamine and chondroitin is I would rather see it in the big picture of the perna muscle. So if you're on green lip muscles or perna muscles, it has the glucosamine and chondroitin and PUFA, the omega-3s in it, and that works really well. In my hands, in my experience, that works much better than a glucosamine and chondroitin where it's isolated from. So think about the perna muscles having like the whole animal, so all the coenzymes and all of that stuff, as well as the omega-3s in there, as compared to the isolated where it's drawn out and it doesn't have the other stuff. The other thing I usually tell my clients is to try like 5 or 6 good quality supplements. And after 3 weeks of being on it, write down, my dog is 1 to 10. Is he a 6? Is he an 8? Is he a 9? Is he a 10? And then once you've tried multiple of them, rotate the top 3. This way you're getting your main, right? So there's in all of the supplements, there's the main core things, but then they all have other things. And sometimes you have enough of one thing, but then you need something else. And by rotating, you get a bunch of different things. So that's my rule on supplements. And again, JOPE, wonderful. There's canine musculoskeletal support from Standard Process that is always on one of my tops because not only does it have the perna muscles in it, it has boswellia. And when we talk about using an NSAID, non-steroidal anti-inflammatory, most of the time we're talking about COX-1 and COX-2 inhibitors. Boswellia is a LOX5 inhibitor, so it decreases inflammation without the stomach upset that sometimes your COX-1 and COX-2 inhibitors, and it's safe if you use it if they're already on an NSAID. So the Standard Process canine musculoskeletal support is another excellent one. And again, I would rotate that with the JOPE and the BioPup or Pup Flex and see what works best for your dog. All right, so now we have Margie trying to do circles and cookie stretches with my 6-year-old dog. I saw her in the tuning fork picture. Yay! She does great to the left, but I'm trying hard to achieve right turns and right touch the hip. She will circle 2 or 3 times to the left and then distract rather than going to the right. Yes, what I would say is you need to have that dog adjusted chiropractically, osteopathically, something. If she can't do it, you don't want to set her up for failure. You want to fix her. She's telling you, I can't, right? So something super important about cookie stretches. You take the cookie, and if they're like, cookie, cookie, and they snap back, it's a pain response. If they're like, cookie, cookie, and the cookie's over here, and they're just looking at it, that means they can't get to it. So it's a restriction response. So I think you do chiropractic, Margie. So maybe you did and she's moving, but if not, I would definitely look into seeing if she's restricted anywhere. Twice the number of right turns, but she's so headstrong, she'll stop the attention and spin to the left. I would look for pain using Fromm Roley, so high value. Okay. I would look to see if she's painful or if she has restrictions and fix that. Abby, great to know about yoked and Myos. I got yoked for my dad after Myos worked for Miss Lady. Yay! And was hoping for something without sugar and flavoring. Myos is far cheaper. Yes, it is. Yes, it is. Madeline, Myos tastes better than yoked. Plus, there's a lot of waste from the individual packet. I agree. I would rather have one big package than a lot of little packages. And don't use it with hot drinks and food. Absolutely, you denature it if you heat it up. Great comment, Madeline.
So Donna has a question of,
Yep.
can we use green-lipped mussels with the UC2?
There is not a study on that. So if it was my dog, I would do UC2 product in the morning and a green lip mussel product in the evening. And again, UC2 products, Jope and Jope, which is Joy of Pets, which I love. Christine's amazing, as well as Veronica with BioPup or PupFlex are wonderful for the UC2, and Standard Process Canine Musculoskeletal Support has the green lip mussels. And I was just looking up, they got rid of Glycoflex, but VetraScience has Healthy Hip and Joint. So another option, a good one that's out there.
Thank you. And thank you everyone for all your questions. And thank you, Dr. Laurie, for your time tonight. And we appreciate that you guys all showed up tonight to hang out with us. Thank you.
All right, everybody. Thank you. I love meeting with you guys. Thank you for your questions. And hopefully we'll put on more of these to help you guys out. Take care. Have a great evening.